Well, let's turn back to the NHS now, and a health service which seems to be in an ever-growing crisis as waiting times and lists grow well before the usual winter crisis. Nurses and ambulance staff will walk out on strike this month, and junior doctors will be balloted on action soon. That will be held by the British Medical Association, which is both the trade union and professional bodies for doctors in the UK. Its council, Deputy Chair Dr Emma Brunswick joins me now. Very good to talk to you. We just spoke to Wes Streeting there, Shadow Health Minister. He says he's not afraid to take you on. He calls you vested interests and says that you think he's a heretic for wanting better patient access. Are you concerned that you perhaps don't have as good a relationship as you should with the man who may well be Health Secretary very soon?
Well, certainly I'm disappointed in the rhetoric that Mr Streeting is adopting.
He said he was replying to charges that you'd made against him.
Well, this morning he's said in the Telegraph that NHS staff are looking for something for nothing. And I think my members and many health staff across the UK will be absolutely gobsmacked by that, because we are giving everything and receiving less than nothing in return, pay cuts, real terms pay cuts in return. And we agree that we want a better health service. You know, we're working in it. I see patients, you know, every week who have been waiting for a long time to see us. And it's really devastating working in that situation where we know we're not providing the standards of care that we want to be. The solution isn't to attack the staff. The solution is to attack the government, who are absolutely responsible for driving our service into the ground with underfunding and staffing.
So surely the solution is fixing this, isn't it? It's sitting down, talking about it and finding a solution rather than attacking anybody. Do you feel that you can talk to the government?
The choice is between attacking and blaming NHS staff and directing the blame where it really is deserved at the feet of the government. Then I think Mr Streeting needs to really focus on the government who are responsible for the problems we face.
There have been dire warnings from all parts of the NHS and some of the statistics that have been, in the news so much over the last few days. In all of your times working in the NHS, have you ever seen it this bad?
No, I think the honest answer is no, we haven't ever seen it this bad. We've got, such extreme levels of vacancy, about 10,000 doctors missing in secondary care alone, 47,000 nurses missing. We've got 1,900 GPs fewer than we did in 2015, and providing more appointments than ever. So 32 million appointments provided by those GPs this year. And yet we absolutely can't meet the demand that we have on the service. And that's a whole mixture of factors, but it means that we can't do as well as we would want to for patients. And, we hear all of the real patient stories that underlines that misery for us. And it impacts on our mental health and our well-being as well. And that's why so many are leaving, and one of the reasons so many are leaving. If we want to fix those problems, we really have to tackle the issues of pay, pensions and working conditions that are forcing staff out. It's not just about recruitment at the bottom end, it's about keeping the staff who are already in the service and providing training to our younger colleagues.
Do you think the NHS can cope this winter?
Well, the NHS is already collapsing and has been for some time now. So are we going to see worsening of that collapse as demand increases this winter, and we have another COVID wave, we have another flu wave, we have the Strep A, both situation and the panic associated with it? Are we going to see worsening situation? I'm almost certain of that. What can the government do?
Do you think more people will die?
I do think more people will die, and I don't think that's not something that we want. And there are some solutions to that, but currently the government won't even speak to us. So we're in a really difficult situation that none of us want to be in as health workers. We've all committed to providing, excellent patient care. We're aware that we're not able to do that at the minute, and we're doing our best. We're driving ourselves into the ground trying to provide that, and we're working with each other. And increasingly, we're organising to take a stand over our service. We want our profession, and for doctors, we want our profession to be valued, and we want our skills across the health service to be valued. we want the government and patients and the public to realise that we are trying, but also we're reaching the point where we have to take action, because if we don't do anything, it will keep getting worse.
And you're balloting your members for a pay rise for junior doctors. What do you think the likelihood is that they will go out on strike in the new year?
I think it's likely, unless the government is willing to negotiate with us about pay. So we're asking for a reversal of a pay cut. We've had, a pay cut for junior doctors of 26.1% since 2008. So over a quarter of our pay has been lost. This year, again, we've received 2% pay award, which is about 10% less than inflation. That's another month working for free, working a whole month for free compared to last year.
Okay, so what would you
the government currently won't even say.
Sorry, forgive me, we haven't got a huge amount of time, but what number would you like if your dream number that the government would give you?
Well, we're looking for pay restoration. So restoration, reversal of that pay cut. Yeah, absolutely. But it's only
you really
a lot
think
of
the
money.
Government will give you a 25% pay rise?
Well, it's only as steep as the money that has been cut from us. It's only as steep as the money that we've lost. So if the government has, the government has continued to give us below inflation pay awards year after year, claps do not pay the bills. We are at a point now where we are, 10,000 doctors short in secondary care alone, 1,900 fewer GPs than we've had in the past. We really need to tackle the problems of keeping staff in the service, and whether that's doctors, nurses, ambulance staff, paramedics, radiographers, the whole team really need to understand and to be valued by the government, and therefore value our patients and the service that we're providing to them as well.
So to be clear on this programme, you're saying you want a 25% pay increase.
We're looking
as
for
you
pay
say.
restoration. So as inflation changes, we will continue to seek restoration of the losses that we've had.
Okay. But you're saying that's 25%. I mean, as you referred to the goodwill that there was throughout COVID and the clapping on the doorsteps. Many in the country would love to see those in the medical profession getting a pay rise. But you also said that you think people will die, partly as a result of the strikes, partly as a result of the state that the NHS is in over this winter. Do you think that there's going to be a change? Are you worried that the public will perhaps not be quite as much in love with the NHS after a few weeks of strikes as they are now?
I think that the public really understand that our desire for investment in health workers and the health service is fundamentally about the wanting to be able to provide a really excellent standard of care for patients. That's what it's about. There's an absolute link between investment in the health service and the quality of care we're able to provide. We all know that we're not currently providing that standard of care. We want to be able to do better. And therefore, we are taking a stand and asking the government to invest in us and the service that we provide. I think the public know that, and I think it's really clear to them. If you don't trust doctors when you're asking this question, then ask the nurses. If you don't trust the nurses, then ask the paramedics. If you don't trust the paramedics, then there's so many of us who are now facing this same set of difficulties, having faced such attacks on our pay, on our conditions, and on our service, the service that we provide to you over such a long period of time. There's so many of us now facing these difficulties. All of us have come to the same conclusion, and all of us are looking for change. And I think that the public and patients will understand that.
Okay, and just to be clear, you do think that it's very likely junior doctors will go on strike in the new year?
I do, unless there is change from the government. It's in the government's gift to
Dr.
negotiate.
That was very clear. Thank you very much. Dr. Emma Brunswick, Deputy Chair of the BMA, thank you very much.